Welcome back to this edition of Dufferin Life. We are going virtual, and I am thrilled to introduce my next guest, Kim Delahunt, who's the president and CEO of the Headwaters Healthcare Center. Kim, thank you so much for joining me today.
Thank you for having me, Tina.
So this is an inaugural celebration. You've been there about a year, and it's quite the time to take over for the hospital. So can you tell us some of the highlights of the past year?
Sure, absolutely. And yes, what a year it's been. I would call it probably epic. So there are many things I'm really proud of that we've accomplished over the past year. Certainly before I came to Headwaters, I was very well aware of the great reputation it had in the community. So I was really pleased to join Headwaters. And, you know, without a doubt, over the last year, COVID-19 turned our world upside down. Our team at Headwaters, however, working with many community partners, including elected officials and municipal and county staff, we really managed to right the ship early on very effectively and really deal with the intensity and the scrutiny and the stress that the pandemic brought. You know, last year our hospital launched into a new strategic plan, and we have a purpose, and our purpose is one community caring together. And I really think now more than ever, we are displaying that each and every day. We also live our values. They're not just values on paper, but we live our values of kindness, passion, courage, and teamwork each and every day. And I see those every day that I come into the hospital. And when I arrived at Headwaters, I was immediately struck by the amazing culture here. There are so many long-serving staff and physicians, and many staff whose families have actually worked at Headwaters over the years and across several generations. So it's really quite amazing. We have a strong volunteer base here at Headwaters, over 300 volunteers who really support the hospital on clinic units, as patient family advisors, volunteer board members, and at seconds count in the community, in the hospital gardens, and that list continues. We could be here for the day talking about our volunteers, and we certainly do miss them now as they are off-site during the pandemic. There are also many community-minded people who give back to our hospital through donations, through our hospital auxiliary or our foundation, and I'm forever grateful for their support. And so, you know, some of the accomplishments that I'm really proud of that we've accomplished over the last year is the ability of how quickly our teams came together to adapt to the pandemic. We had to really ramp down activities early on to ensure the safety of everyone. And, you know, while still keeping essential services up and running, we set up our COVID-19 drive-through assessment center in literally 1 week. It was record time, and it was done so with the involvement of many community partners. You know, I'm proud of the willingness of our members of our team to work in other areas in the hospital. Many of them have been redeployed, and they did so willingly and with grace. And then I was really proud of our team and their ability to ramp back up. So we're back, you know, doing all of our surgeries, all of our procedures, all of our clinics, but we did so in a very slow and steady way that ensured the safety of patients and families and staff always. Over the past year, we also renewed our urology program to treat diseases and disorders of the urinary system in men and women. And we have a new spinal assessment and education clinic for patients with long-term back pain who are considering surgery, and also a new rapid access clinic for patients considering hip or knee replacement surgery. And, you know, in response to the growing needs and feedback from our community, we've developed a plan that will ensure that we continually upgrade equipment and the facilities at the hospital, the building itself. And, you know, we recently finished our main entrance, our welcome center renovation. So we've got a new safe staircase, which is great. So we can welcome everyone safely into the hospital. And again, all of this work is through the generosity of members of the community through our hospital foundation and our hospital auxiliary. And I just want to do a special shout out to Joe and Paul Wader, whose donation made the work of the Welcome Center possible. And then lastly, I'm really proud of the work our Hills of Headwaters Collaborative Ontario Health team does each and every day. We were one of the first 24 Ontario Health teams announced in the province.
That is absolutely amazing and truly an epic year for sure. And congratulations on your first year. That's wonderful.
Thank you. Thank you.
What are some of the hospital's challenges moving into the next year?
Yeah, so, you know, no doubt we're still dealing with the pandemic. And that will continue, I'm sure, into the next year. So a lot of our focus is always on continuing to maintain safety across the hospital and across all the programs and services we offer. We're also trying to get rid of some of the backlogs of surgeries and other procedures due to the ramp down early on in the pandemic. There is certainly some concern right now about the cold and flu season, along with the ongoing pandemic. And, this puts a lot of stress on the hospital, the system as a whole. So we're continuing to evaluate that each and every day and planning very carefully. The pandemic has also put some strain on our financial resources at the hospital, and that will continue into the next year. At the end of the last fiscal year, we were projecting to have a small surplus. However, with the onset of COVID in March, we did end up the year with a small deficit, unfortunately. And there are ongoing costs and expenses related to COVID, which continue to increase each and every day. And certainly the government is providing hospitals with funding for the expenses due to COVID-19. However, at this point, they're not covering any capital expenses or lost revenue. So that will be a pressure on the hospital moving forward. The pandemic has also, been a marathon that has continued for over 8 months now. So it's not a sprint, it is certainly a marathon. And, we are all human. And I want to continue to encourage our teams to take care of themselves and one another and their families as we are in this for the next little while for sure. And, on a personal level, for all of us who've got children, families, extended families, everyone is concerned about the well-being of their families, the ability to pay bills. It's a real concern. And again, we are providing our staff with the resources that they need, and we're encouraging them to really take care of themselves and their loved ones. The wellness of our team at the hospital is a real priority for us over the next year.
Absolutely, most definitely. You have an amazing team at the hospital that works very hard, and their health and their well-being is paramount, obviously.
Absolutely.
For sure. So, what can people expect when they come to the hospital now?
Yeah, so certainly things have changed, but I think my most important message is I do want to let everyone know that the hospital is a very safe place to come to. If anyone requires care, I encourage them to come to the hospital and get the care that they need. Everyone is screened now before entering the hospital, and we at this point are still only welcoming essential visitors. But we have opened up for surgeries, procedures, as well as a full complement of outpatient care and clinics. So, the screening will happen before anyone enters the hospital, and anyone coming for surgery does need to follow the specific protocols given to them by their surgeon's office. And we have also just begun a pilot program with our spiritual care volunteers on one of our wings, our E wing, which typically has more longer stay patients. So, in a nutshell, our staff and physicians are still here, ready to provide the best possible care that is needed for anyone who needs to come to the hospital.
That is amazing. And can you give us an update on what's happening with the COVID-19 Assessment Center moving forward?
Yes, absolutely. So, after nearly 8 months, our drive-through assessment center tent is going to be winding down its operations. It really can't withstand the winter elements here in Dufferin. So we are moving it into the hospital. That is going to happen next week, actually, so the second week in November. And, people will need to book ahead of time. And I'm just going to say the toll-free number now. So we are taking appointments. The toll-free number is 1-833-442-0001. So anyone can call to make an appointment. And then the new location is going to be at 100 Rolling Hills Drive near the emergency department. So just on the other side of the hospital. There will be free parking available for everyone that's coming to the assessment center to get tested. And as I mentioned, this change is happening the second week in November. All of this information is on our website and will be promoted throughout all of the social channels. So please, I encourage everyone to look at that. And, I want to give a shout out to our team here that has been tirelessly working on the transition of the tent inside the hospital and with the really quick ramp up of our new call center for booking of appointments.
Well, that sounds amazing. I can't believe how much you've undertaken in such a short time. You just took over the helm, and then all of a sudden everything just kind of went crazy. So
it has been a busy year.
And you look completely sane. So
thank you.
For sure, for sure. We have about 3 minutes left. So are there any messages to the community that you'd like to share?
Yeah, thank you, Tina. I would like to take a few months just to give a few thank yous to some folks. And, this list is a little long, but I'll make sure it's 3 minutes or less. First and foremost, I am thankful each and every day for our staff and physicians here at Headwaters. Many of them live locally, many travel from afar, but they are really here to serve patients and families each and every day, and I'm forever thankful. Our team here has been committed to providing the best care during these difficult times at the hospital and at our drive-through COVID assessment center. So a big shout out to them. I do also want to acknowledge our Friendship Gardens volunteers who did return to work outside on our gardens this spring and throughout the summer and now in the fall. And they are always ensuring that our gardens are still admired and can be admired by everyone in the hospital. And the gardens really bring such great joy to staff and all the patients in the hospital. I'm grateful to all of our neighbors around the hospital for their patience as we went through many ups and downs with our drive-through assessment center. For many weeks, we did have cars lined up and down rolling hills and on the grassy field. So I want to thank all of our neighbors for having patience to withstand that with us as we pivoted to increase flow. And then, I'm always extremely thankful for the generosity of members of the community and the businesses during the pandemic, especially. We received countless donations from the community through monetary donations and through donations of personal protective equipment, food, coffee, meals, gift cards, clothing. The community really stepped up to support us, and I want to thank them. And all the messages of hope and kindness that we received as well on social media, those always brighten our days. And thanks to the town of Orangeville, they arranged for an art contest with local youth to write and draw inspirational messages for our staff, and they were put up those pictures along Rolling Hills Drive. It really warmed everyone's hearts each and every day. And finally, I want to offer a huge message of thanks to our patients and their families and supports who since March, they've been patient with us and we've been working through all the changes. So big thank you to everyone, to the community, and thank you to you, Tina, for having me here today. It has been a real pleasure.
It has been my pleasure to have you, Kim, and thank you so much for taking the time out of your busy schedule and being one of the family members of somebody who's been in the hospital, I think 3 or 4 times throughout, not myself, someone from my family. I can't tell you enough how wonderful the care has been and what good care they've taken of my mom and how truly I appreciate the safety measures as well, because we all have to be safe. So thank you for all that you do, Kim, and for joining us today.
Thank you very much, Tina. Have a lovely day.
Thank you for joining us. I'll see you next time. Bye-bye for now.